Good afternoon, ladies and gentlemen. My name is Garcia. Today I will be presenting on health reform, education, and assistance for families living with multiple sclerosis. So, what is multiple sclerosis? Multiple sclerosis is a chronic disease that attacks the central nervous system, primarily in the brain, the spinal cord, and the optic nerves of the human body. A study done by the National Multiple Sclerosis Society approximately says that 400,000 individuals in the U.S. live with multiple sclerosis, and some of their difficulties that they live with are mobility problems, fatigue, emotional impairments such as depression, and cognitive impairment, thus making it very difficult for them to manage or understand their healthcare coverage. So the problem is poor quality of life for individuals suffering from multiple sclerosis. Some of the causes are lack of healthcare, high cost of healthcare, which is between $8,000 and $54,000 a year, and lack of knowledge of the Patient Protection Affordable Care Act. Some of the consequences are greater risk of MS progression, limited access to MS-specific drugs or neurologists, or poor access to healthcare, which what I mean by that is not utilizing their healthcare coverage to the maximum, or if they're not knowledgeable enough to possibly get the best benefits from their healthcare coverage. So here is a basic healthcare reform summary of some of the terminology that I'll be using in my presentation. Medi-Cal is basically a public health insurance ran by California, or half by California and half by the government. Primarily, before January, it only served single parents and disabled under a certain eligibility of income. Now it serves any individuals or families under a certain eligibility of income. And then we have the Affordable Care Act, which is new, also known as the Obamacare, which is a private insurance marketplace called Cover California here in California. Basically, it's some of the main points of protection, as protection for patients, is that insurances can't charge you for pre-existing conditions. There's consumer assistance, free preventative care, and subsidized insurance, which means if you have an income too high above Medi-Cal, then there's also, you could go into Cover California Marketplace and you could get a private insurance there as well. And then the last one is Medicare, which is a federally sponsored healthcare program for people over 75 or 65 and disabled. Something changed in Medicare is there's more preventative services for less money, and the elimination of the donut hole, which basically means they speculate that in 2020 there will be no copay assistance or a cap in assistance. So here's the agency that I did my intern at. We're called the Multiple Sclerosis Quality of Life Project. It was started in 2004. And it's a nonprofit 501c3. The mission statement is MSQLP recognizes that people living with chronic illness have unmet needs. MSQLP is committed to helping fulfill these needs by improving the quality of life of individuals living with MS through free services such as case management, supportive services, and educational events. With the help of two paid staff, board members as you see on the right, volunteers and interns such as myself in the counties of Monterey, Santa Cruz, and San Bernardino. So here's a brief, quick, step-by-step what I did for my project. First, I had to learn about healthcare. I actually had no idea what it was, or I knew what it was, but I didn't know enough information to actually go help apply it. So I did workshops with the Nonprofit Alliance of Monterey County and Central Coast for Independent Living, where I learned about each levels of healthcare, Medicare, Medi-Cal, and the Affordable Care Act. After that, I went into our database at MSQLP and basically collected clients' info of income and healthcare coverage to see if they could possibly benefit from any of the changes. After that, I did a mass email to all clients to give them an opportunity to get my help. And from there, I collected 4 clients and did phone consultations with a pre-test. 2 of them were in Monterey and 2 of them were in Santa Cruz, where we reevaluated their client's care or healthcare coverage. So continue on with that. With each client inside the one-on-one sessions, I provided an education packet, which basically gave a brief description of Medicare, Medi-Cal, and the Affordable Care Act. And also I guided and supported clients through many different applications, such as Medi-Cal application, Medicare application, different Affordable Care Act plans, which bronze, silver, gold, or platinum. And also I provided each client with local health insurance brokers around where they're stationed. The reason why I did this is because I never became certified in healthcare, so I was never able to make that final step or decision with clients. I was only there to educate them or assist them in figuring out which way they should possibly go. So I always told the client to go and get finalized with a health insurance broker or a healthcare navigator. After that, I did a follow-up with the clients where I did a post-test and gathered the client's thoughts and comments of the one-on-one sessions. So here I did, I'm talking about each client, but there's basically one format that I use that I just briefly spoke about, where I did a pre-test, either in-office visit or home visit. These two on this page are in-office in Monterey. And then I provided education packets about Medicare, Medi-Cal, and Affordable Care Act, connected them to local health insurance brokers, and did the post-test on the follow-up. Now, each client had different needs, so I had to learn about different areas of healthcare. For client number one, I had helped her go through Covered California and the different plans. Because they're not too knowledgeable about different plans, I have to sort of go through step by step of what it means when they're going to be charging for deductibles, or how much percentage of their Part D plan will get covered. For client two, I did, she wanted extensive research or education on Medicare Part D, which is the drug plan. I did that with her, gave her a bunch of education on that, and then also she wanted information on returning to work, what would happen to her Medicare, so I provided a lot of information on that as well. For client three, these both were in Santa Cruz, where I went to their home and visited them. For client three, I helped her with the Medi-Cal application and also signed her up with CalWin benefit application, which is basically an online website where you can manage your Medi-Cal and your CalFresh food stamps. Makes it easier for her so she doesn't have to keep calling different places or calling a number on the back of a card. And for client number four, they're getting Medicare in the summer, so they just wanted extensive research on Medicare. Basically, I provided a pamphlet that and went over it with them, parts A, B, C, and D of Medicare. And then from there, just did the follow-up pre-test or post-test. So here are my evaluations. The 3 questions that I did during the pre-test, it was on a 10-point Likert scale. The questions are: how informed are you about healthcare reform? How informed are you about the changes to Medicare? And how informed are you about the changes to Medi-Cal? As you can see in the pre-test, their answers weren't that very high. The highest answer was a 6. But even when I was talking to them, they seemed sort of shaky saying it was a 6. And as you can see in the post-test, except for one client, which I was unable to reach, their levels significantly risen. So it was a positive outlook, especially on the healthcare reform, because it was a new thing that just started in January, and it showed that my packets actually helped them. And I also think they're being a little generous with me, because healthcare is hard to understand, even if you put time into it after all. So for my conclusion, with education and assistance, clients that live with multiple sclerosis can feel more confident when managing their MS and maximizing their utilization of their healthcare coverage under the new application of the healthcare form. People with MS, they suffer from a lot. A lot of times they don't have the capacity or actually just the strength to actually go and start learning about things. They feel even folding laundry is a big task for them, depending on what level of MS that they have. Something that I learned is that understanding everything about healthcare is already difficult for a healthy person like myself, let alone more difficult for someone living with a chronic illness. So my recommendations for students or anybody actually going into this field: get certified. That was one little pet peeve that I had, is that I had to always stop myself from actually saying, okay, this one seems like the best plan for you. Because I'm not certified, I would actually go get certified as a healthcare navigator or an insurance broker. Something a recommendation I have from my agency is biannual updates about healthcare. Since healthcare is always changing, you never know when one change could actually really benefit one client, and that's a huge thing for those clients, because they can either save money, get better quality of care, or something that they just don't know because they're not knowledgeable about it. And also, last recommendation is acquire a Spanish speaker for accessibility. I know a little bit of Spanish, but not enough to actually speak to somebody and fluent about healthcare, especially with all the big words and all that. And especially that our mainly clientele, or some of our clientele is, and families and individuals speak Spanish as well. So I just want to say thank you for everybody being here right now and listening to us this whole day. Thank you to the CHJ staff, especially Barbara and Adrian and everybody for really supporting me. My friends and especially my family, I really wouldn't even be here if it really wasn't for them.